Hi everyone, my name is Nimrit Gahoonia. I'm a second-year medical student at Touro University College of Osteopathic Medicine, and I work with Dr. Sivamani at Integrative Skin Science and Research. So today I wanted to talk to you all about a clinical trial that we're conducting on SIBO. So to give you a background on what exactly SIBO is, it stands for Small Intestinal Bacterial Overgrowth, and as the name implies, it's caused by an imbalance of the gut microbiome, which causes a variety of different symptoms in patients, including abdominal pain, gas, constipation, diarrhea, and bloating. Traditional treatment is typically antibiotics. However, those can be cost prohibitive as insurances often don't cover antibiotics for this condition. So a study conducted previously investigated herbal therapy on treating SIBO, and they found equivalent results of herbal therapy compared to antibiotics. And so for this study, we were interested in investigating that further. So we wanted to specifically look at the impact of an oral botanical regimen on the gut microbiome and skin biophysical properties of those with SIBO. So looking at our methods, this is an open label prospective study, and we only are currently recruiting those who have SIBO as confirmed by a lactulose breath test that we administer. And this study is ongoing still. And the intervention that we are providing is a 10-week oral supplementation of GI detox and biocidin liquid tincture. And after those 10 weeks, if they are still testing positive for SIBO, then we go ahead and administer a third supplement called Olivirex for an additional 4 weeks. And throughout this study, patients are assessed at baseline, week 6, 10, and 14 if they aren't responding to the treatment. Here, moving on to our results section, these results were obtained by conducting a lactulose breath test, which I mentioned earlier, and that measures the levels of hydrogen, methane, and hydrogen sulfide gas over 2 hours in 15-minute intervals, and high levels suggest the presence of SIBO. So these figures show the data from 13 of the 16 patients that we've recruited so far. And as we can see, hydrogen gas is commonly abnormal in most patients at baseline. And overall, out of the participants that had high hydrogen gas levels at baseline, 40% saw a reduction by week 6 of treatment. And similarly, 100% saw improvement in hydrogen sulfide levels by week 6. And overall, at the end of treatment, there was an average reduction of 66% in hydrogen gas levels. So just to conclude overall from this study, we can say that intervention can be helpful in those with hydrogen and hydrogen sulfide gas abnormalities with this herbal therapy. And another thing to note is that patient compliance is a big factor in impacting the course outcome of using herbal therapy for treatment of SIBO. And that is all for my presentation. Here I've listed the conflict of interest. This study was funded by Biocidin, and my references are listed here as well. And thank you all so much for listening. If you have any questions, please contact me at this email address, or you can contact Dr. Sivamani, which is the PI for this study, at this email. Thank you so much.